Start.
Hello, I'm Dr. Trivedi, a doctor working in this clinic. May I confirm that I'm talking to Fran Ronald's 68 years old daughter?
Yes, doctor. I really wanted to discuss about my father's current condition. And are you the treating physician for my father?
Yes. Actually, I'm the physician who, who are going to talk. Who is going to talk with you in this matter? You will do all right.
Okay, doctor. I am really worried that I saw him last time in the ward, and you have shifted him to the intensive care unit. Why have you done this? Is his condition very severe?
Okay. Yeah, I'm going to talk more about his condition, your father's condition. Uh, uh, but before I start, may I know that how much do you have an idea about your father's condition when he got admitted?
Okay, doctor. Actually, he needed admission also before, and he had a severe liver disease. And this time he also developed some blood vomiting. For that, we have taken him to the emergency department.
Okay, and uh, okay, and may I know when you last saw him?
That was in the morning.
Okay, and how is he then at this? May I know how did you
His
find?
condition wasn't good enough, doctor, because he has a very bad liver condition. But he was somewhat, he could recognize us, and he was on the ward, though he was some drowsy.
Yes. Well, at this moment, I would like to say something more about your father's condition and about some managements of your father. Okay, will it be okay?
Okay, doctor.
Yes, actually, what you said was completely correct. Actually, he had some bloody vomiting, as you said, and because of this bloody vomiting, he got tail. Actually, okay, what we say is that anemia. Do you get it?
Yes, doctor.
Yes, and for that, actually, uh, we ordered uh, blood for him. Okay, and this blood was very much needed for him. But unfortunately, as soon as we started giving him blood, uh, he seemed to have some reaction to.
Doctor, he needed blood before, but he didn't have any reaction. What are you talking about? What type of reaction you are talking about?
Yes, actually, some when he actually had as soon as uh, we started giving him blood, he had some raised temperature. He developed some chills and rigor, and unfortunately, his BP also blood pressure also fell down sharp. Uh, are you getting?
Yes, doctor. Why did this happen? He didn't have this type of event before.
Uh, I get it. At this moment, I would like to uh, I would like to say that actually there have been a very wrong mishap in your father's case.
What? What has happened,
Yes,
doctor? Say it me clearly.
yes, I'm very sorry to say, but uh, actually your father's blood group is O positive, I guess. Am I right?
No, doctor. He is a positive.
Sorry, he's A positive. Am I right?
Yes.
Yes. So actually, uh, there was a mishap in the hospital chain actually because uh, very it was a grave mistake and he was wrongly transfused with O positive blood.
What
And
are you? talking about, doctor? You gave him wrong blood. You made his condition worse. Who did this? And you are now
Uh,
talking about that you made this wrong decision. You didn't take care of my father.
yes, I'm very very sorry at this moment. Actually, uh, there has been, I think there has been some problem in the total communication system here, because there was another patient named Ryan Raspberry, and we reckon that there was a mishap within these two names because his blood group was O positive, and it was a great accident that your father was wrongly, although having A positive blood, he was transfused with AO positive. So actually, at this moment, because of this transfusion, he got quite worse.
Doctor,
And
I cannot accept your talkings. You have transfused him with wrong blood. You know that his condition is very worse, and he has rarely survived with this condition. And you have again given him this wrong blood, and you made his condition worse. How this can be, doctor? Who is responsible for this?
yes, actually, uh, at this moment, we are looking into the matter very, very seriously. We have already informed our hospital manager and the whole chain, including our doctors, the hospital nurse, and our workers. Everybody are being scrutinized now at this moment to find out actually what caused this mishap. And you can be quite sure now that there will be a very strict, uh, strict.
Doctor, this is why my father's condition got worse for this wrong blood
Actually,
transfusion.
I'm sorry to say that actually your father has been ill for quite a long time. This time also he came with a very bad condition. But I can't refuse that this mishap actually might have added more to his condition. And
For
I know,
this reason, you have transferred him to the ICU.
well, actually, I cannot deny it, but that this is also a reason why we have shifted him to the ICU so that he can now get very very specialized treatment. And even if he gets much worse, we can give him some special medication, some special machine support as well. Are you getting me?
Okay, doctor. So you are saying that for this condition, for this wrong transfusion, this has happened to my father, and you are going to kill him. It is just like a murder, doctor. I cannot accept it.
I get it, and you have already lost an incident report in this case, and we have already let all our authorities know, and they have started scrutinization. And you can be assured that we will get to you as soon as possible with the scrutinization result. That what has made this
This will not bring my father
wrongdoing.
back, doctor. Is my
Uh,
father going to die?
well, I'm very very sorry to say that at this moment his condition is not so good, but we are uh, helping him and trying to provide him the best possible treatment we can actually. Okay. We have already shifted him to ICU as a preventive measure so that even if he gets worse, we can uh, give him special treatments as much as we can. Are you with me?
Okay, doctor.
Uh,
Totally unacceptable.
well,
With his poor condition, with his poor
yeah,
health condition, and you have again did this wrong. This is not a minor mistake. It is a great mistake, and this is going to kill my father. This was
well,
all our fault,
uh,
doctor.
Yes, I am very very sorry, and I can I actually cannot refuse that this was a very great mistake. And at this moment, our focus is on to our focus as our doctors is to treat your father as good as possible. And also, our hospital authority is working on this accident. That what happened, why this happened, and you can be sure that assured that uh, uh, your father's mishap or accident is being considered very very seriously as a very very serious uh, incident. Are it and it is being investigated. Are you getting?
Okay, doctor. This is totally unacceptable.
Uh, Sorry.
This is totally unacceptable, doctor.
Yes, I get it, and actually, uh, it is one thing is that we are going to do our hospital investigation, and there even if you are not satisfied with the explanation of the hospital or something like that, I think you can seek other opinions as well, or you can also lodge complaints as well if you are not satisfied after getting our report or getting our answer. Okay, are you with me?
Okay, doctor. This will not bring anything good to whatever you have now.
Okay, okay, actually, we are trying to do our level best now at this moment. uh well, may I know that is there anything more that we can do to help you or your father at this moment?
No, doctor. I am just losing all hopes that I had.
uh at this moment, I would like to tell you that we are very very sorry, but uh, please don't lose hope at this moment. We are our whole team is with your father at this moment, and we are dealing him very very seriously now. Since there has been one mishap happened, we understand that it is very difficult for you to have trust in us, but we are trying our level best now to treat him, to make him well as much as we can. uh, are you getting me?
2 minutes remaining. Okay, doctor.
Okay, are you getting me? Okay, okay, and at this moment, actually, may I okay, and may I ask you one or two more things now?
Okay, doctor.
But did your father express any wish in case he needed some serious, in case he got seriously sick like this condition,
No,
that
doctor.
how he want to get treated?
I don't know anything like that.
Okay, okay, and okay, I can understand actually, but I'm very very sorry at this moment. But did he had any advance directive? You know, any advance written advices to you?
No, I don't know.
Okay, okay, okay. And did he appoint any person to take decisions for him if he gets votes or like that?
No, doctor.
Okay, I can get it. And may I ask you once again that is there anything more that we can do, or any more question that you have that I can answer?
Just one thing, doctor.
Yes.
Will his condition improve?
At this moment, we are trying our level best to treat him, uh, and we are reviewing him in a very timely manner now. So, but we can't tell for sure at this moment whether he will improve or not. But we are uh, doing our level best now to making it better. Are you getting me?
Okay, doctor. Time up. So, do you need a minute or you want to start now?
Yes, I think I can start now.
So, what was your task?
My task was to explain Ryan's daughter the condition and why he is in ICU.
Okay. And what type of task is this?
Uh, what type?
Yes.
I cannot get it. What type? I think it's more both. It's actually apologizing for the mistake. I think, and also assuring about the treatment that the
Okay.
hospital is trying to help.
Okay, that is right. It is actually a case of medical error.
Yeah.
Okay. And so, what do you think? How far you have you been able to convince her?
Well, I think. I think I tried to convince her, but actually, our main focus was at this moment was about her father's health. So she was not too much excited about lodging a complaint or something like that. Very much angry why this happened, but I think she was focusing more on her father's welfare at that moment. So I think I tried my level best to convince her. And she was, although she was very unhappy, but still she I think she kept faith in our treatment, and she wanted to know whether her father can improve or not.
Okay, that's fine. So actually, this case you were much worried, but this case was you went well in my view. And one thing that you should have apologized in the, before telling that this was a medical error, so that I could patient would get the idea that you are really sorry why this has happened.
When should I apologize?
Okay, you have the patients the daughter has asked you that why he is in ICU, what has happened to him in the meantime. Then at that time you could say, okay, I can, okay, I actually I'm sorry, very sorry for that because there was something wrong happened in your father case.
Mm,
And do you have any idea about that? Okay, no.
mm,
I am again sorry for this type of inconvenience that have occurred. Actually, his condition was so bad when he came to the hospital. Then he needed
mm,
blood transfusion for he needed blood transfusion for that, and we started transfusion after doing the proper cross messing. We after doing the cross messing, but yes,
mm,
after a few minutes of transfusion, he developed this fever, he developed shortness of breath.
mm,
Do you get me?
mm.
Okay.
Yes.
Uh, did he ever had this type of symptom? No. Did he ever had need any
Mm,
blood transfusion? Yes. Did there was any problem that time? No.
mm,
Yeah, actually, and do you have any idea that if the person develop this type of fever, shortness of breath, etc., during this blood transfusion, what do we do?
mm,
Yeah, no. Okay, actually, this if this type of happens, we call it transfusion reaction. Okay. Do you have any idea of that? No. Actually, in this case, the transfusion reaction occurs for a few case, for a quite few cases. There might be something wrong blood given to anyone, or sometimes the blood body cannot accept the blood. And I am extremely sorry to tell you that in your father's case, the wrong blood was given. That was another person's blood was given to your father. So this happened. I'm extremely sorry for this. Then the
mm,
daughter would say, okay, why this happened? How did this happen? You should have taken care. Okay, I can understand your anger. This, but this actually happened. There will be some type of miscommunication, and this is a serious thing. We have taken this condition seriously. We have informed all the regarding authority, and we are trying to find out that why this has happened. Okay.
Mm. Yeah.
And one thing that you made a mistake, that you told me that his father is A positive, O positive.
Yeah.
You should
Yeah. I just
you should have write it down, because that
I wrote it down. Yet I just
that
it is
that
slip
means
of tongue
that
actually.
means that even you didn't care of it.
Yeah. I just understood at that moment. I just that was a slip of tongue actually, but
Okay.
it was
But
a
this was a
great
serious mistake.
great long day.
This was a serious
Yeah.
mistake. Sorry. Otherwise,
Yeah.
your everything was fine. And when I told you that is he going to die, you were totally honest that yes, I cannot, I am not sure, but his condition is getting worse. I cannot tell you that exactly,
Yeah. Yeah.
but that might be you told this way. That was fine. That you didn't
Okay.
show me the false.
Okay. Okay. So I think that was I think although I was not perfect, but I think I did a bit
Yes,
good.
you did well. You did well.
Okay. Okay.
And
So I think we can stop.
and you have explained the condition, that current condition, and why he is in ICU. Okay.
Yeah.
And
Yeah.
for this,
Yeah.
his BP was falling. He was not responding to the treatment, so he needed good care. So that you have sent him to the ICU for his better management. That was very fine.
Mhm.
Just
Yeah.
apologize,
Yeah.
apologize many times. Okay.
Mhm.
Whenever you get time, just apologize. This will convince the patient that yes, you are extremely sorry for this, and you are trying to
And
end it.
well, I told on myself that she could apply, she could appeal to some other authorities. Is that right?
No, if
I
she
don't think I
did,
could have.
if she didn't, you have also told her that yes, you are going to try, you are going to find out the matter. And otherwise, if she didn't ask for any complaint, then why you are uh, asking him to complain against? If she
Yeah.
if she
That
needs
was
any
not
complaint,
right.
then you can
When I
always say,
was
yep.
telling it, I was thinking about it.
If she was asking for any complaints account, and if she wanted to file a case against you, your hospital, then you could say, okay, it is your right, and for this I can guide you to the respective
Yeah.
authority for this.
Well, another thing, I was actually thinking that I was doing wrong by telling. However, another thing I want to know that when I asked him about advanced directives or LPA, was that right? Because he was
Yes, yes,
admitted in ICU. So
yes. This patient's liver condition was not good, and
yes.
even he made it advanced directive that even if any condition arises, that from where the survival
So,
will less, or the quality of life after the resuscitation would be worse. He will not uh, permit that in advance. So
yeah.
that was good. That was good. You asked for that.
Okay.
I was waiting that when you will ask it.
Okay. Okay. So I think we can stop the recording for this.